I'm a thoracic surgeon. I've been practicing thoracic surgery now for 22 years. I specialize in minimally invasive surgery, also in maxillary invasive surgery, in the treatment of lung cancer, esophageal cancer, mesothelioma, both in the chest and abdominal cavity. So there are many benefits of doing cryoablation in our patients. It's not for every patient, it's important to understand that, and it's not also for every case. There are selections, and I think it's important for those who are embarking on this new technology and a way of manage pain to understand that. Cryoablation actually works by touching the nerve with a probe and freezing the nerve, and that allows the pain to be manageable after the surgery. Most of the time we do local anesthetics or local regional, and this is another way to complement that. So I want to stress the fact that we probably, and we shouldn't replace one for another. So we still do the local anesthetic, which lasts just a few hours, to cryoablation, which then will last longer than the local, yes. The surgical technique never changes or shouldn't change for what we do every day. What it does change is the way we perceive pain and how we treat it, and which is important. I had patients which I did one small incision, and they had a lot of pain. In others patients, I did a large incision because the size of the tumor and the location, and they had almost no pain. So the difference really isn't, in my view, whether it's a small incision or a large incision. The difference is how we actually injure or damage the nerve, because you go right onto the nerve that you can actually see it and block that nerve. Pain causes disability, an ability to move around, an ability to do what you like to do, going to work, going to the movies, going to the grocery shopping, so your life is restricted. Once we can manage pain in a combination of local, regional, systemic, with cryoablation, local anesthetics, and some systemic therapy, then the recovery is much better. I usually ask the patients, how far do you live from the hospital? And they tell me, says, I'm gonna drive home, or you're gonna walk home. And they look at me and says, the faster you walk, the sooner you walk, the faster you go home. This allows us to do that. Our results really support the use of cryoablation. Patients have great results and they're happy with it.